Now, Jonathan, in the book, you've described or even mentioned just briefly some of these dynamic flows that are part and instrumental in the new health age. Tell us a little bit more about what those dynamic flows are and what they mean to the future of healthcare.
Yes, the 9 dynamic flows that David and I have come up with to describe the future of healthcare in America really center around 3 core areas. One, how we think about healthcare is going to change, how we deliver healthcare is going to change, and the economics around healthcare are going to change. And really, when you go back to one of your first questions, Charles, what is the new health age? We spent over a year researching this topic and really wanted to try to drill down and take a lot of the noise out of the debate and the discussion that's occurring in America today about healthcare.
Right.
Drill it down into some very succinct, understandable concepts that people could relate to, and that's what these 9 dynamic flows are about. So just to give you a few quick examples,
Sure.
One under the thinking flow. When Americans think of healthcare today, so many of us think of healthcare as where we go when we are sick or when we are injured. And it's not that in the 21st century sickness and injuries will go away, but we're going to think about healthcare in a much more broad sense of the word and much more inclusive, and include wellness, prevention, and the concept of a holistic system. Where we look at healthcare as where we go to prevent illness and to stay well versus just being reactive.
Reactionary.
Exactly, reactionary. On the delivery side, another flow that's major for the future and is occurring today is integration. Today, healthcare to a large degree functions in silos. Perfect example of that is, let's say, hip surgery. Patient falls, breaks their hip, taken to the emergency room, diagnosed broken hip, transferred to the OR, surgery's done, transferred to the floor, maybe discharged at that point in a few days, goes to rehab, goes to physical therapy. All of those episodes and episodic treatments are very siloed. Healthcare is going to become a lot more integrated moving forward in the sense that you're going to have more parties coming together, coordinating the care through technology, through joint ventures, through agreements, and through the payment system. So a lot more integration. Then speaking of economics, we're moving into a performance-based model under healthcare. I mean, as David said under the 80-20 section, think of all of the areas of America and in our economy where people get paid for their performance.
Exactly.
You know, the top performers get paid more than the low performers. All of that economic incentive program is coming to healthcare. Those that produce the best results, the highest quality, the low infection rates are going to get paid more than those that don't. It's going to be an economically driven and motivated system.
If I could jump in
David.
here, Charles. You know, one of the reasons we wrote this book is the current conversation about healthcare reform is driven by misinformation, fear, and manipulated by politicians. And so sometimes it's easy. The way to think about it is just to think about it very easily. Like Jonathan just mentioned, integration. So think about how you buy an airline ticket. Now, you just pay once, right? You don't have the ticket agent charging you, the baggage handler charging you, the flight attendant charging you, the captain charging you at all. I mean, it's all integrated, and yet in healthcare, each one of you get an invoice from each one of those. Just in that hip surgery situation that Jonathan mentioned, there are about 3 different invoices you would get that you would have to figure out, and you don't know whether it's valid or not, and you can't comparison shop. So just think about the way you buy an airline ticket. That's the way you're going to be able to look at healthcare, and it's going to be integrated.
And imagine the cost savings that what
Exactly.
David and I just described will bring to America. We haven't talked a lot about that, but that's at really the sort of the core of the 20th century model, and what we're having to move away from in the new health age is controlling the cost.